I'm pleased to be joined on Health Beat by Dr. Chandra Ponniah with Faith Regional Physician Services Family Medicine in Norfolk. We're talking about high blood pressure or hypertension. So what is normal blood pressure and how is it recorded or measured?
So basically there's two measurements for blood pressure. Systolic pressure, the pressure in the arteries produced when the heart contracts at the time of heartbeat. And then diastolic pressure is in the arteries during relaxation of the heart between heartbeats. So blood pressure is reported as systolic over diastolic. For example, if the doctor says 120 over 70, that means 120 systolic and 70 diastolic.
I see.
Normal blood pressure is less than 120 over 80. Pre-hypertension is 121 to 139 systolic over 81 to 89 diastolic. There are two stages of hypertension. Stage 1 is when your systolic is 140 to 159 and your diastolic is between 90 to 99. Stage 2 is when your systolic is 160 or greater and if your diastolic is greater than 100. So most adults with hypertension have primary hypertension where the cause is not known. A small percentage of adults have secondary hypertension where the cause is by kidney or other hormonal disorder.
I see. So what are risk factors for hypertension?
There are many causes of hypertension. The older you get, the higher chance of hypertension, obesity, diabetes, high intake of salt, lack of exercise, excessive alcohol consumption, high cholesterol, certain medications such as ibuprofen taken for a long period can cause high blood pressure too.
Okay. So what are the symptoms then of hypertension?
So most of the individuals do not exhibit any symptoms, but sometimes it can cause headache or dizziness.
Sure. So the complications, what would the complications be of hypertension?
It can cause heart attack, stroke, bleeding in the brain, and then kidney disease.
So what could we do to control high blood pressure?
So there are many things you can do to control your blood pressure, including weight loss, regular exercise, dietary changes, including reducing salt intake and avoiding alcohol, smoking cessation, medication. You will need to talk to your doctor what medication is right for you.
So once again, a good diet and taking care of yourself.
Exactly.
Yeah.
You got that.
Thank you so much.
All right.
All right. And that's Health Beat, brought to you by Faith Regional Physician Services.